Cold weather may feel cozy to us, but for newborn animals, it can be deadly. Let's explore neonatal hypothermia, a common but preventable killer in young ones. Neonatal hypothermia is a life-threatening but preventable condition affecting newborn calves, lambs, piglets, foals, puppies, and kittens alike. It happens when an animal loses more body heat than it can produce, causing body temperature to fall below healthy levels. This is especially dangerous in the first hours or days of life, when energy reserves are limited and the mechanisms to control body temperature are immature. Etiologically, hypothermia can result from exposure to cold temperatures, especially in neonates or older weak animals whose muscles aren't active enough to produce heat. It's often linked with metabolic problems such as hypoglycemia, low blood sugar, hypocalcemia, low calcium, acid-base disturbances, and other imbalances. Risk increases with hypoxia, prolonged unconsciousness, dehydration, malnutrition, or emaciation, weakness. Epidemiologically, piglets and lambs are especially at risk due to their small size, leading to rapid heat loss, minimal fat reserves, and wet coats at birth. They're born into environments often tens of degrees colder than the uterus, and modern practices like off-season births and overcrowded housing amplify the danger. In lambs, more than 30% of early deaths are linked to hypothermia. In calves, over 50% die within the first 48 hours. Similarly, puppies and kittens can't regulate their temperature for several weeks. Their body temperatures range from roughly 95 to 99 degrees Fahrenheit, 35 to 37.2 degrees Celsius, in the first week, and they require external warmth, ideally from their mother or a carefully controlled heat source. Pathogenesis begins when neonates are exposed to cold. Initially, neonates shiver to generate heat, but once energy stores deplete, they become weak, mentally dull, and their breathing slows. In severe cases, body temperatures can fall to 30 degrees Celsius or lower, with clinical signs including cold extremities, slow heart rate, weak pulses, pale mucosa, and shock. Clinical signs common across species include body temperature below 37 degrees Celsius, lack of strength and reduced activity, cold ears, paws, or limbs, bradycardia, weak pulse, shock signs, pale or cold mucous membranes. Thermoregulation depends largely on insulation from the hair coat and skin, but in neonates, this natural barrier is often weak or insufficient. One of the most crucial factors in preventing hypothermia is early intake of colostrum, which not only provides passive immunity but also essential energy for heat production. For example, a 40 kg calf needs about 2.4 liters of colostrum shortly after birth, with an additional 125 milliliters for every 1 degree Celsius drop below the thermoneutral zone. Lambs should consume approximately 180 to 210 milliliters per kg of colostrum within the first 18 hours. Puppies and kittens also require warmth, dry body surfaces, and a carefully controlled environment, such as a neonatal box set at 29 to 32 degrees Celsius with 55 to 65% humidity, to help maintain their body heat. Treatment depends on severity. Mild hypothermia, 37 to 39 degrees Celsius. Dry the animal, give warm colostrum, and keep them in a dry, warm, sheltered space. Severe hypothermia, less than 37 degrees Celsius. Farm lambs less than 5 hours old, give 20% glucose warm to 39 degrees Celsius, intraperitoneally. 50 milliliters, large, 35 milliliters, medium, 25 milliliters, small. Calves, administer 50% dextrose IV at 1 milliliter per kilogram. Puppies and kittens, rewarm slowly, over 30 to 60 minutes, using safe methods, warm water bottles, rice sock, incubator. Feeding should only begin once euthermia, normal body temperature, is attained, since a chilled neonate can't digest properly and may regurgitate or aspirate. A warm start to life matters. Recognizing and preventing hypothermia in neonates saves lives. Stay prepared, stay informed, and keep your animals safe with VetCare.